Good morning, good afternoon, and good evening to everyone. And I welcome you all to the 148th Uninterrupted PH. And let's start the session with a small prayer. Thank you. As we all know that IFPH is conducting 3 sessions every day, and now we are here for the second session. And about our today's guest is Dr. Shantha Chandran, expert in infertility and female complaints, a leading practitioner in Kerala, and having 45 years of clinical experience, and winner of many awards, including Swami Adurada's National Award. And she had handled more than 1,500 successful cases of infertility. She had given many presentation in our local language session, and in last month she has talked about male infertility in English session, and now she is going to continue the session. Now she is here to present on the topic of female infertility and its homeopathy management. And I'm happy to invite Dr. Shantha Chandran. Welcome you, ma'am. And the mic is yours.
Thank you, Dr. Sweta, for your
Thank you.
words. Thank you, Dr. Danish. Thank you, everyone. Thank you, the pillars of homeopathy, pillars of IFPH. Thank you so much for giving me an opportunity to present my experience in this female infertility.
1 minute, madam. Mr. Vishnu, are you here? If you are there, if you may please raise your hand so that we can make you co-host, because the Vishnu is the person who is sharing the screen. Vishnu? Yes, madam, you may begin. I shall call him and will share soon. Okay.
Can I start, Dr. Danish?
Yes, yes.
Thank you, Dr. Danish. Female, as you know, everybody, we are all doctors. Everyone know female infertility refers to in women, which is the inability to conceive after unprotected sexual intercourse for 1 year. And the treatment depends on the cause of infertility. First, common and general view, that is age of the couple and the number of coitus. Age of the couple, I should say, age is not significant significant in males. In female, best before 24 years, and there is definite risk above 35 years. And number of coitus in a month. General health, emotional stress, tension, health of couple, mental depression, anxiety, everything comes under this causes of infertility. Most type of female infertility cannot be predicted or prevented.
Please wait.
But there are,
Madam, please wait. Vishnu will share it. Share the
screen.
Okay,
I'll tell Dr. Haben to share. Okay. Okay. There are steps to improve the chances of conceiving. These include lifestyle changes, medication, weight management, etc. And investigation comes hormone assessment, ovulation testing, imaging studies to assess the uterus and fallopian tubes. Test to find ovarian reserve. Medical history and physical examination, including previous pregnancies, gynecological conditions, and medication. Physical examination. Okay, doctor, cause of infertility. Can you share the slide? Dr. Vish. Yes, first slide, cause of infertility. Next one, next post, not the other one. Next one. Anovulatory cycle. It's not clear. First and foremost, cause of infertility is, as everyone know, without ovulation. Definitely there should be a very healthy sperm also, but without ovulation there won't be, and that pregnancy won't take place. There will be no fertilization. You can't see it. It's not clear, doctor. No problem. Anovulation. Absence of ovulation when normally expected is known as anovulation. Anovulation is often the result of an unbalanced hormones that cause a woman to ovulate and may be part of the condition. That is PCOS, PCOD, PCOS in irregular menses is indicate anovulation. In that there is premature menopause before the age of 40. That's also a reason. For this reason, we will have medicines like epicindinum and miasmatic medicines. Miasmatic drugs we can use in this phase. Premature menopause before the age of 40. I'm talking about anovulatory cycle. And we have a variety of diagnostic tools to help to determine the cause of irregular cycle and anovulation. That test we can do is from home test. This ovulation kit can be used, and ultrasound for follicular study from 10th day of menses. Then we can find out whether ovulating or not. And hormone test, that also is very helpful to determine the ovulatory cycle. For anovulation can be due to stress of the women who come in a new family, that for adjustment in a new family, that can cause an ovulatory cycle, and irregular menses also we can have. In such conditions, my as well as my friends, we discuss each other, and our line of treatment is first constitutional remedy and some organ remedies. Like with stress to adjust in a family, we can have the medicine like platina and lycopodium, pulsatilla. Such medicines can be used in an ovulatory cycle. And constitutional medicines like graphitis, calcarea carp, corneum, natramor, etc. are very good medicine for an ovulatory cycle. First, you have to determine why that irregular cycle and an ovulation is happening. In PCOS, you have many follicles. It's completely one endocrine hormonal defect in PCOS. But in PCOD, it's clearly lifestyle disease. In PCOS, we have to administer that hormonal medicines. You have to do hormonal assay and according to thyroid and other hormonal conditions, we have to select the medicines. But in PCOD cases, we can give that exercise, lifestyle, that weight management, weight reduction of weight, exercise, etc. will help in PCOD to produce that ovum. Next comes anovulation and decreased ovarian reserve. Here, reduction in the number of and the quality of egg in women, that is ovaries leading to impaired fertility. This can be that congenital deformities in ovary, like rudimentary ovary, premature ovarian failure, and with age also after 35 years, you have egg quality will be less. Genetic factors, autoimmune disorders, and procedures like radiation, chemotherapy, and certain surgeries can damage ovary, and you have decreased ovarian reserve. Lifestyle like smoking, obesity also can cause decreased ovarian reserve. Here, our homeopathy medicines, we can use the medicines like curcuma mother tincture, and definitely constitution medicine, plus this organ remedies like ovary, lecithin, oleum jack. These are gave me very good result in decreased ovarian reserve. We used to suggest one little turmeric in 1 glass milk at bedtime will increase the AMH, that is increase the ovarian reserve. The next cause is luteal phase defect. Here, when your uterine lining does not thicken or grow enough to support the pregnancy. That is a thick uterine lining is necessary to grow a pregnancy. So people with a luteal phase defect may struggle with infertility or miscarriage. This, here we can find luteal phase defect, recurrent abortion in early months, and abortion every 3rd month, 2nd month, 3rd month, that way. So we have, for luteal phase defect, we have wonderful medicines like Viburnum brunifolium, and we have so many medicines in repertory that abortion every 2nd month, abortion early months, abortion every 2 months, every 3 months, every 6 months, like that. So many medicines are there in our repertory. So we can select the medicine according to that conditions. And this, while we are doing follicular study, we can make out the size of the ovum as well as the thickness of the endometrium. If that thickness is less, we can use that our CERTS prescription is Damiana potency and Yohimbinum 3x. That gave me very good result in applying in luteal phase that defect when we do follicular study. That's ovarian complete. Next comes the luteinized unruptured follicles. Luteal phase may be shortened as a result of defect of follicle or defect of ovulatory or defect of LH surge to follicle rupture. This is when this we can make out from the hormonal study. When we do that hormonal study, LH surge will be less in unruptured condition of the follicle. Endocrine, this is clearly endocrine dysfunction. It can be abnormal thyroid function and increased prolactin. That's in irregular menses. For increased prolactin, we should find out the reason, whether there is any pituitary tumor, or that you have to rule out pituitary tumor and treat accordingly. And we have wonderful medicines for increased prolactin. Tuberculum higher potency is very effective in increased prolactin, and as well as borax, Merxol, borax, and thyroidinum, aurum muriaticum natrum, conaeum. Such medicines will help in luteal, luteinized unruptured follicle conditions. When we find when that follicular study, if the follicle is not rupturing, we can use silicea, also very good remedy to rupture the follicle. Next condition is ovarian causes over. Next comes tubal factors. Tubal factors becomes tubal adhesions. Tubal adhesions, also known as peritubal adhesion or pelvic adhesion, and pelvic adhesion. Bands of scar tissue that form around the fallopian tube due to inflammation or surgery. This disrupts the normal function of the follicle, normal function of the fallopian tube, leading to infertility and ectopic pregnancies. This causes are PID, that is inflammation, PID from infection, from STD, and surgery, that is a removal of ovarian cyst, bowel surgery, etc. And endometriosis. As everybody know, endometriosis is a very important cause of infertility, and endometriosis, anywhere endometrial tissue can develop, and this, and one more, that surgery to appendix, replaced internal trauma, replaced ovaries, etc., can cause tubal adhesions. And tubal endometriosis also is one cause in tubal adhesions. And one more thing, and inside the tube also, you can find tubal polypus can cause infertility. That can cause small growth protrude into the tube, obstructing the passage of egg or sperm. That polypus, due to inflammation or of previous surgery, can cause tubal adhesions. Here, tubal adhesions, we can use the medicines like thiocyanina, treat according to the cause. That endometriosis, as you know, so many So many medicines are there for endometriosis. If the tubal defect is due to endometriosis, we can have to use that endometriosis medicine, endometriotic medicine, endometriosis medicine we have to use. And endosalpingeal, the endosalpinx is the mucus. Endosalpingeal damage also is a cause with the tubal factor. That is, endosalpinx is the mucous membrane lining of the fallopian tube. Damage to this lining can disrupt normal function of the tubes, transporting eggs from the ovaries to the uterus or sperm to egg for fertilization. The main cause is PID, and then we would say that is the tubal conditions. And here, tuberculinum and thiosiaminum, graphitis, Calcaria flu are the important medicines for tubal adhesions. Okay. Endometriosis. Next comes the reason of infertility in uterine factors. Am I audible? Is it okay, doctor? I don't know whether.
Yes.
Uterine hypoplasia. Regarding uterine factors, there is uterine hypoplasia. That is definitely congenital complaint. Here, our treatment is miasmatic drugs. Inadequate secretory endometrium, fibroid uterus, endometritis, and congenital malformation like bicornate uterus, unicornate uterus, septate uterus, etc. comes under this uterine factors. And here, endometritis is again the villain of the uterine factor. For endometritis, the foremost medicine is that we have to select according to the pain. The pain associated with how we select is the pain with the backache. We can use Polophyllum and Calica. If it is associated with bowel symptoms, then like IBS, there's a good medicine with ammonium carb and Bovistin. And associated with bladder symptoms, we can have Cantharis, Naxomica, Sabina, such medicines. Then endometriotic medicine, all the other symptoms with endometriosis, as everybody know, that is dyspareunia is there. If dyspareunia, we can have argent and nitrica, arnica, platina, such medicines. And Sepia, Natramur, also very good medicine. Associated with the dyspareunia, we have such medicines. Here is the uterine factors. Then come immunological factors like anti-sperm antibody, anti-phospholipid, hereditary, thrombosis, etc. One more cause I forget this thing here. Cervical factors. Cervical stenosis is a very bad condition for infertility. Narrowing of the whole lumen, that can be congenital or acquired cause. That can be due to repeated vaginal examination can cause cervical stenosis. Here in modern medicine, they will do widening of cervical canal. Here our medicine effective is cactus and graphitis. It's a good medicine for cervical stenosis. Then comes insufficient cervical secretions. The cervical secretion is very necessary for the nourishment of and transportation of a spermatozoid. This cervical secretion builds upon pituitary and other ovarian functions. And psychological factor and infection. Drugs like hydrastis, lycopodium, lysine, natramol, and plumpum will help for this condition, insufficient cervical secretion. Then comes vaginal factors. Vaginal factors important is vaginal obstruction. Vaginal obstruction. Here, after coition, return of semen will takes place. That is due to vaginal obstruction. Then comes vaginismus. This is hypersensitivity of vagina, which makes penetration impossible or extremely painful. This can be due to fear or anticipation of intercourse. Here is anxiety. Anxiety and partner issue also is a reason for vaginismus, and we can expect childhood experience also a reason. Here our homeopathy medicines, cactus, platina, natramol, and argentonitrate can be used. Then immunological factors, anti-sperm antibody. To reduce that anti-sperm antibody, we can use hydrastis, echinacea, medorinum, alumina, arsal, etc. Curcuma is very good remedy for immunological disorders. Only then special investigation, as everybody know, and this much only I have to tell. Any questions I can answer. Okay.
Thank you, ma'am. Thank you for your interesting session. And doctors, now if you are having any doubts or if you want to share something, you can raise your hands and you can share your words.
Nobody is having any doubt. I am not an authority in this area, but I share medicine about improper exercise. Okay, improper exercise. Egg should be, while we are doing follicular study, the egg should be 20 millimeter size. So for to increase the size, we can use ovary 3x is a good remedy. Curcuma is there, and constitutional medicines definitely. And we use lecithin and oleum jack continuously, so that will develop the ovary, that egg size. Increased prolactin will cause reduced ovary, reduced ovulation, anovulatory, and galactorrhea, decreased libido, dyspareunia, etc. This we have to find out any malignancy or any tumor, pituitary tumor, anything. And medicines like cyclamen, chimafila, tuberculinum, pulsatilla, hytloca will give good result to reduce prolactin. And we should advise them Swiss bath to increase the pelvic circulation, and food supplement like spread more sprout in with your diet. That also will help to increase the ovum. Or tubal and peritoneal PID, or tubal blockage, should such cases be deal with hormone. Definite for tubal occlusion, we have very good medicine, UPO, tuberculinum, upion, thiosiaminum, alumina are very good medicine for two. If it is congenital fimbriae, that fallopian to fimbriae damage, that we can't do. But otherwise, that end of the medicines for endometriosis and additions will help to reduce the tubal additions, tubal blockage. Upion is definite medicine to reduce the tubal blockage. And tuberculinum. We should find out the reasons. If it is any family history of tuberculosis, we can have such medicines. All iodine group also very good. Aurum iodide, barite iodide, calcarea iodide. Or should that be that? Once again, I didn't see that properly. Potency. Physiological dose 3x. Arsinosin also we can. But that's what our line of treatment should be. Constitutional first. Constitutional medicine and miasmatic medicines are boon to not only homeopaths, but the human beings. It's our master Saniman invented that constitutional. So both physical ailments like anemia, hormonal abnormalities, TB, physical that diabetes, vitamin deficiency, everything should be considered. Regarding coition, that time of coition, some people used to ask. Coition also is very important. Some ladies used to tell, you'll have, today one patient came to me, they were telling, once in, I asked them number of coitus regarding, monthly once or twice, hardly 4 times. How will they conceive? So what I am telling, coition, number of coition also is very important. Some ladies used to tell that period time, they will count from the day of first day of period, that is 14th day, 14 days, 14th day, 13, 14 and 15. After that, if we do coition, if fertilization happen, that will abort. And before that, what happens? Let the sperm become more healthy and more, that count more. So we are waiting for up to 13th or 14th day. I feel it's not correct. I used to tell them, see, when you do the act, then only that sperm will produce. Whenever that sperm is needed, that time only that is produced. And that ovulation is not, if the period, if at all 14th day, 28 day cycle, we can tell it is 14th day is the ovulation day. But that doesn't happen. sometimes when we do a follicular study, there will be more follicles in that. One follicle may become big and it will rupture. Other follicle will be in rudimentary, but that means some size 2 for the 13, 14 like that. Then when next cycle begins, so this already having that follicle can develop. So that 14th day, 13th day is not a definite day for the ovulation. So number of coition is very, very important. You should advise the patient to do frequently. That means at least after the period, alternate days, once in 2 days intercourse. If that uterine pH and that semen pH is same, that sperm will be alive in 24 to 48 hours in the uterus. So when the egg get ruptured, if there is sperm inside uterus, that will get fertilized. If you are doing once or twice in a month, that can't be helped for if you want to conceive, that is very less.
Madam, there is a question. When both tubes are blockaged, should such cases be deal with the homeopathy, and how? When both tubes are blocked, how one can manage the case with homeopathy?
If both tubes are blocked, that is, we should see the reason. If it is some after effects of some surgery or that if previous tubal pregnancy or endometriosis, that can be treated. If it is congenital and that fimbriated end is rudimentary, we can't do that surgery. Should be. I don't think, as far as my knowledge, I won't say we can treat this.
Yes,
Otherwise, with endometriotic medicine, addition medicine, tuberculosis medicine, you can make it all right.
Your friend, Dr. Ambadi, is here. Dr. Ambadi, can you add anything to that?
If the tubal block is there, the Chandra told Upion. Upion is a very good medicine, and tuberculum. And if we want surgery, we have to do it.
There are people coming.
If it is adhesion, thiocyanamide 3x works well. No, Chandra?
Yeah, thiocyanamide 3x, that too in powder form.
Yeah, 3x powder.
Yeah.
Not a tablet, only trituration. We used to give 3 times. Me and Chanda used to give 3 times a day for 1 or 2 months. Continuously. It melts. Dissolves the scar.
Recurrent abortion, you can Viburnum pronifolium is wonderful medicine, and nowadays modern techniques are there to find out where there is imaging test, USG associated or that fallopian tube abnormalities, everything you can make out. HSG procedure, you can visualize the uterus and the tubes to identify the blockage. Saline infusion, sonography also, histogram. Here saline to fill the uterus, providing clear image of uterine lining can also be done.
If anybody have any question, please open your video or you may raise your first hands so that we will allow you to unmute yourself and you can speak. Madam, can you explain? Please explain one of your case here, infertility case, a female
Okay,
infertility.
I can explain one case. See, everybody is telling if there is regular menses, then only you will conceive. But I have a case without there was no regular menses. But I believe is if ovulation and ovum size, so 20 into 20, and that endometrial thickness 10 millimeter, then he can conceive. Then there is no need of the regular menses. In PC, polycystic ovarian disease, there won't be the regular menses. So the patient comes once the period become regular, then only you will conceive. That's their belief. But I used to tell for regular, there is no need of regular menses to conceive. You need ovulation. So I used to ask whether you want ovulation, you want to conceive, or you want regular menses. He was telling no, we want to conceive. So I give preference to that ovulatory cycle to induce ovulation. Such cases that mostly I got result with pulsatile CM. That is in irregular period for PCOD cases. Pulsatile CM. If there are so many injections, hormonal treatment, and vaccinations are done, then I give Tuja CM. So recently, I got result with Tuja CM and Pulsatilla plus this lecithin, ovary, and oleum check. Then ovulation happened and conceived. So I give more importance to ovulation.
Hariran sir, you can ask your question or speak.
I have nothing to ask because
Yeah, doctor.
Doctor, namaste. Namaste, namaste, namaste.
Namaste.
I have nothing to ask, but class is very nice. Congratulations. He is the very expert regarding this infertility. Actually knows everything. But doctor, any special medicine to raise the AMH?
Yeah, definite.
What is that medicine?
To raise the AMH, curcuma tincture. Lecithin. Lecithin 3x powder. Or oleum jack 3x powder. Ovary 3x powder. Is giving me good result.
Thank you.
Also, I used to tell the patient when they get the result with AMH less than one and all, I used to tell the patient to take more sprout, include more sprout in their diet, and also quarters little good turmeric powder boiled in 1 glass milk, take daily. That also giving good result. Also, Swiss bath to increase the circulation of pelvic circulation.
Ma'am, Dr. Aishwarya is asking lecithin in what potency should use?
3x.
Okay, ma'am.
Chandra, shall I tell one thing about low AMH?
Huh?
Chandra, shall I tell one thing about low AMH?
Yeah, you help tell.
See, first understand the reason for the low AMH, then prescribe. Because repeated IUI, IVF, etc., here we can think of Salsagria tenum.
Yeah. That's correct.
And if it is that abortion, then give syphilinum 10.
Syphilis and
Yeah.
recurrent abortion, you start with syphilis.
Syphilinum 10. Then Dr. Ramakrishnan from Palakkad has got a protocol. I used to give, and I have got result also. That is X-ray 200 and Nux mosquita 200 on alternate days.
To increase
Per week.
AMH.
Yeah, to increase AMH. X-ray 200 and Nux mosquita 200 on alternate days per week. And give cactus as well as ashwagandha tincture.
Yeah, that's also good.
Yeah. That way, I
But I
think
forgot.
Sandra forgot.
Sorry.
We used to practice, no? We used to give, no, Sandra?
Yeah.
You would have forgotten. That's why I told.
I forgot that. I forgot.
Ma'am, another one question is there in chat box. Dr. Anita is asking about the dosage of ovary 3x powder.
Ovary 3x powder, if it is AMH very less, we can give 3 times a TDS.
Okay, ma'am. Then the next question is, Dr. Rituraj is asking, any supportive treatment for husband should we give to increase sperm quantity and quality?
Yeah, support. That is depends upon the reason. No, if it is varicocele or such conditions, no. That male infertility I told last time. Yes.
Should be
to
corrected.
increase the sperm count. Not always.
Dr. Hani suggests a medicine to increase the libido of ladies.
Libido in ladies, very good medicine. Onosmodium 1.
Onosmodium. See,
Onosmodium 1.
Onosmodium 1. See,
Yeah.
Onosmodium 1 frequent also.
No, one BD is enough. Twice a day.
Two days.
And one more thing, to develop the egg. When we do that follicular study, the egg is in a small size. We can give Baraita carbapenem. 2 doses. That will increase the size of the egg.
Shall I tell one thing, Chanda?
Yeah.
To increase libido in both males and females, we can very well give ashwagandha tincture to both of them, as well as Agnes tincture also.
Can I suggest one medicine? Doctor?
Yeah, correct.
See, Cantharis tincture before bedtime.
Pardon, doctor, which tincture?
Cantharis.
Cantharis is very good. That too in black coffee.
Black coffee
or black tea.
coffee, Cantharis tincture. Very
Cantharis
effective.
tincture.
Very effective. But don't repeat, because
don't
otherwise
repeat.
Don't repeat. If you repeat it,
if a person
burning urination will cause. But otherwise, it is very, very good.
I think on the particular day only, or
that day, that before.
If they want to have coition, they should take Cantharis tincture. No.
Okay, that is. Before 2 or 3 hours before, you can give Cantharis tincture in black coffee. It will do good.
Both of them.
To the male, to the male.
No, both of them.
Female, for female.
Female.
See,
Onosmodium also give wonderful result, doctor. If the person is having migraine, definite action.
Okay.
He is telling with the migraine, definite action with onosmodium.
Usually, veterinary surgeons give this Cantharis tincture to give the cows.
Ah,
Usually they will do that, and they are getting result also. They said to me that it is good for cows.
for pelvic inflammatory disease, you can use Baptisia tincture for 1 or 2 months. That is Dr. Padmanabhan's prescription, and that gave me good result.
And we can give all anti-inflammatory drugs, whatever may be indicated. You can very well give.
Thank you, Ramaji.
We
for the
both are
support.
we both are joining and joint
We are
treatment. We are
discussing and
done, no?
giving the medicine.
Dr. Shanda,
Yes,
can you
doctor.
suggest a food menu for males to get more strength for his action and see the strength for his penis or a long time? Can you say a food menu
For males, no?
for males?
For males. I suggest 1 orange a day, 1 cup of curd daily, and all dry fruits. Sprout, when they sprout, and too much water intake should be more.
No.
See, one article last time I read. See, these pumpkin seeds. Pumpkin seeds are very
seeds. It comes under dry fruits, dry seeds. Pumpkin seed is good. Okay,
Yes,
doctor, thank you.
very good. And one leafy vegetable.
Leafy vegetables.
Ogeria or something else. But I searched in Google, and I found out that it is not in our India, but in other foreign countries, they grow such vegetables, and they are using during their food, along with their food. But in India, it is not available. Then see that article, they say that magnesium, red meat. Red meat is very good for such patients. Red meat, because it contains more magnesium.
Magnesium.
And that is good for such patients. Usually patients are coming for us to us, so prescribe for a food item for them. So that is why I asked this question.
Okay. I used to suggest all these things: dry fruits, millets for PCOD ladies. In millets, the seeds also will come. Pumpkin seed, everything.
Sprouted dates. That also 7th day.
Pardon? 7th day, what is?
Sprouted day. 7th day, they let them use.
The female infertility is a vast subject. It can't be each and every reasons we have to go through elaborately. So I gave a short attempt for this thing.
Yes,
So
ma'am. Thank you, ma'am. But the session was really nice and informative.
Thank you.
And
thank you so much.
now I like to call Dr. Jumana Hassan to share a few words and to share vote of thanks.
Yes, it's Actually, I feel both honor and pleasure to deliver the vote of thanks and also to enlighten the points that is very informative and the sharing this much of experience. In fact, you included diet and everything. Yes, doctor. Am I audible?
Yes, doctor, you continue.
Okay. So greetings to everyone. It is my honor and pleasure to deliver the vote of thanks and to tell a few words regarding this webinar session regarding the topic, the infertility and its homeopathic approach, and which is done by Dr. Shanda ma'am. And of course, Rama Devi ma'am also included her points and valuable insights, which is their mostly they have included their experiences, which is very valuable for new gen like us. And for enlightening this webinar, on the behalf of the organizing team, I extend my heartfelt gratitude to the speaker, and also you have detailed every explanation regarding the holistic approach and also regarding the dietary management in infertility. And a special thanks to all the participants, doctors, students, and all the health enthusiasts, and your thoughtful questions and interactive. That was really an interactive session. And I'm feeling really grateful to attend this session. And also special thanks to the webinar coordinators and all the IFPH members. Also the host, Dr. Shweta. Thank you all. Thank you, ma'am.
Thank you so much.
Thank you, ma'am.
Thank you, doctor.
Thank you so much.
Thank you, doctor. Thank you.
Thank you.
Thank you all the participants. Thank you so much.
Danish sir, shall we wind up the session and shall we hand over to the next?
Yes, yes. Now there's an announcement for tomorrow. Tomorrow we will have a session from Dr. Huang Bilong from Brazil, and Dr. will be